There are 3 stages of labor. The first stage is while a mom is dilating, the 0 to 10 dilation part. The second stage is from the time a mom is 10 centimeters till the time the baby's born, so basically pushing time. And the third stage is from delivery of baby to delivery of the placenta. It's not over till the placenta is out. And this time period is really critical. Ideally, as when the baby's born, the uterus shrinks down to about the level of the belly button. And if you feel your uterus right after your baby's born, it feels like a hard rock, or at least it should, because the uterus is cramping down over all those vessels that were feeding your baby and preventing you from bleeding too much. Basically, it's acting like a tourniquet, and if your uterus doesn't cramp down over all those vessels, then, like I said, you bleed too much and we have problems. So, in the immediate postpartum period, your nurse will check your blood pressure and massage your uterus every 15 minutes because the most likely time for you to hemorrhage, if you're going to do so, would be the first hour. So we watch you very closely. And by massaging the uterus, it stimulates it to contract, and it also gets any blood clots that are in there out so that they don't start to increase and build and number and prevent the uterus from cramping down as well. So it's not fun. It hurts really bad. It's like rubbing salt in a wound, but it's really for your own benefit. As time goes on, the risk of hemorrhage decreases, and so the amount of time we massage your uterus decreases. We watch you really closely still for the next, 6 to 12 hours. Then after that, we usually just check your uterus once a day. There's plenty of things that you can do to help yourself during recovery. You can massage your uterus in between your nurse's checks, and that will stimulate your uterus to cramp down. And watch for signs that you're bleeding too heavily, whether you're in the hospital or at home. If you're saturating a pad in an hour, that's too much. So let your nurse know if you're still in the hospital, and if you're at home and that's happening, that's a reason to go to the emergency room. As far as the postpartum period goes, it lasts for about 6 weeks, and this is the amount of time it takes for your uterus to cramp back down to its normal size, back behind the pubic bone. Your hormones return back to normal, your bottom heals. There's all sorts of things going on. For the first probably 3 to 4 weeks, you'll still bleed. And it's very similar to a period. So let's say you have a normal period that lasts 4 to 6 days. The first day or 2 are always the most significant, where you bleed the most, it's bright red, and you have the most significant cramping. So that's like the first week or 2 after you've had a baby. And it will slowly taper off. So it goes from being bright red to brown to pink to white. And if it doesn't taper off in both the amount and the color, and the color change is an indication of old bleeding, so it's not active bleeding, then this is a reason to talk with your doctor. By the time you go see your doctor again at your postpartum visit at 6 weeks, you shouldn't be bleeding at all, and they'll check everything out and make sure that it's healed. As far as pain goes, this whole cramping process that we've been talking about hurts a lot. So your doctor will likely prescribe 800 milligrams of ibuprofen to be taken every 8 hours, and you'll want to be faithful at taking this around the clock for the first couple of days to reduce the discomfort from cramping. There's other medications as well. About 85% of moms go home with some type of stitches, whether this be because you had an episiotomy or because you spontaneously tore. You will have some discomfort after delivery from this. And even if you don't tear, it's kind of like the baby skidded through the birth canal, and it's like falling on the cement and getting little raspberry burns. That's kind of like what's happening inside. So it is uncomfortable, but there's things you can do for it. The doctor will prescribe some numbing spray. It's kind of like putting out a fire when you spray it on your skin, and there's Tux pads, and the main ingredient in that is witch hazel. And it's very soothing to broken skin and also helps to reduce the size of hemorrhoids and discomfort that they cause. For the first 24 hours after you've delivered, you'll want to keep ice on your bottom, and that reduces inflammation and again numbs the area and reduces discomfort that you're feeling. And if all of that still isn't enough, then the doctor usually prescribes a narcotic that you can take on top of it all. And all of these things are totally safe with nursing. If at any time you have pain that feels different than the cramping, a weird abdominal pain that's increasing in intensity in spite of pain medications, it's in a different location, or it's so severe you feel like you can't function, if you feel like your bottom is hurting and something's not healing well down there, if you suspect that you have an infection, any type of infection, a bladder infection, a breast infection, especially if you've developed a fever, make sure you call your doctor. And again, if you saturate a pad in an hour, this is never normal and you should seek medical attention immediately. I hope all goes well for you and you have your baby. And if you have any other questions for me in the future, feel free to ask them on our Facebook page at facebook.com/intermountainmoms and recommend us to your friends and family too.